do thank you for joining us. I am aware that some people might find it difficult or have particular emotions around that, and we do understand. Do come and go as you may wish to. But we are, and I've mentioned, the session is being recorded and it will be available online after the event. That's our intention. So what we're going to go through in this session is particularly to talk about the renewal process and the process for continuing professional development, including discussing the peer reflection requirements. So just to start, I can see my slides are just being a bit slow, so hopefully they're picking up. I think it's because there's quite a lot of people in the room at the moment. So Social Work England, I'm sure most of you will be familiar with Social Work England by this point. After all, you're here. Social Work England is the national regulator for social work in England. It does what it says. We've been in existence since 2019 and manage and oversee the register of social workers in England. There are roughly 100,000 social workers in England, just under, and we collect information about that register. For example, that there are 83% of the register are female, and 13% male. That may or may not be a surprise to you. Another data about where the social workers are geographically in the country, the spread across the country, and things like the age of social workers. So if you knew that the average age of social worker is 45, it may or may not surprise you. But actually the spread between the age groups is pretty uniform, apart from under 30 and over 60, which has smaller numbers, perhaps for obvious reasons. But between 30 and 40, 40 and 50, 50 and 60, relatively uniform. Now, in terms of the register, if you're wanting more information about the register and just what social work looks like, we do publish Social Work in England reports each year. We've got a link on the slide, so you can go back and have a look at that if you'd like to, if that's the kind of thing that interests you. So as well as overseeing the social work register, we also set the professional standards for social work, and we are responsible for handling any concerns that come in about social workers through our fitness to practice process. We also set education and training standards for initial training into social work, and we inspect education providers as well as all the qualifying courses. We've recently run some consultations about post-qualifying courses, including AMP and, as will be, AMCP training and education standards. And there'll be some information, as I say, at the end of the presentation about that, if that's something that would be an area that you're interested in. So, as I say, Kate and Gavin will be managing some of the questions that are coming up in the chat, and we will be taking questions as people are coming in. I know people are coming in all the time, so just bearing with me, and just a reminder to people coming in that we are recording this session. So this is the regional engagement team. As you say, there's 3 of us here. We cover England, and we do have our contact details on the website. So if there are any further questions coming up, please do look for the relevant regional engagement lead. Do contact us. Our contact details are on the Social Work England website. So professional standards, I'm not going to dwell too much on the professional standards, not least because I'm sure you're all very familiar with them. But we're going to be particularly focusing on standard 4 through this presentation, and a look at what maintaining continuing professional development looks like, and hopefully answering some of the questions. I can see there's questions about peer reflection. Don't worry, we absolutely will cover that. That will be a good chunk of what we talk about through the session. But initially, I just want to run through the renewal process, because we are in that renewal season at the moment. So between the 1st of September and the 30th of November, the application to renew is open. So we are in that part at the moment. Some of you may have already applied to renew. If you have, do put it into the chat. But that period is open till the 30th of November. And just as we're talking about it, I would like, you'll hear me saying this quite a few times, which is a plea to not to leave it till the last minute. We have this 3-month period, but we really would recommend that you do this sooner rather than later, because one never knows what might happen in the future or in the next few months, or when one might be sick or not leaving things to the last minute. So really, really is in your interests to start the process at least sooner rather than later. But we'll be talking a lot about that through this session. So in terms of what is the social work register, so these are all the social workers that are working or able to work in England, that are able to call themselves social workers, because we do have a protected title. One can't refer to oneself as a social worker if you are not on that social work register. And it is each of our responsibilities as registrants to remain on that register and to ensure that our registration is up to date and renewed. So it's not a responsibility of an employer to remind you, although they might. We have this personal responsibility as a point of our professionalism. And if you are removed from the register or remove yourself from the register, that would mean that you would not be able to practice as a social worker. So it's really important to maintain that registration. And also, I mean, just as a side point, if you do wish to rejoin the register after coming off the register, there is an additional fee to pay. So it's an additional £135. So there's a financial aspect to ensuring that you remain on the register as well. So in terms of the steps to renew each year, there are the three parts to the renewal process. One part is about ensuring you record your CPD. We're going to talk a lot about CPD through this session, so we'll just come back to that. There is the fee to pay, which I can see there's some questions already coming up about the fee. And it's the £90 a year. That's been remained the same since the HCPC. There is an option of paying in two parts with the direct debit or in one chunk as you go through the renewal process. And then you actually need to complete the form to apply to renew your registration. It's not an automatic process. You need to go through the form. So I'm going to take you through the form. Some of you may have done it already. Some of you may not have yet, but we'll go through the form. And just to say that this year we are asking if people can add equality and diversity information on the form. Now, this is not compulsory. You do not have to do this. This is voluntary. The reason we're asking people to add this information to the account is to help us understand what the register is like better, to have a better understanding of what social work in England looks like. And if there are any particular areas of social workers that are affected by perhaps discrimination or inequality, for example, through the data about referrals for fitness to practice. It's also so that we can understand if there is an impact on a particular protected characteristic in some of the policies that we have, and ensuring fairness in our process. So while it's not compulsory and you can remove this information from on your account at any point, we are asking if people can add that information. So if you've been through the renewal process, you'll recognise these. This is what the renewal is looking like at the moment, and I'm just going to take you through the screenshots of how you get through this on your application forms. So you're going to the account, you're going to the overview, and there will be a banner saying that the renewal period is open. You will, first of all, be given an indication of how long it might take you to complete that information, that you can do part of the renewal form, leave it in draft, and then come back and do it later. The other thing just to mention is that you don't have to have done your CPD by the time you complete your renewal form. You can complete your CPD up until the 30th of November, although we would recommend you do it sooner. But the two are not necessarily linked. And we are asking for details of employment, and I'll come through that through the renewal process. So, and then you get the information, and then this is one of the first. You're going through on the progress details on the left. There'll be your personal details, checking your demographic information is correct. You've got the right name, you've got the right address, because you might have changed your name. and you certainly might have changed your address. But also just to mention about your email address, we would recommend that you use a personal email address, not a work-based email address, because this is how we will contact you, and work can sometimes change. So ensure that your email address is the one that you have access to independently of work, and that the name that you use is the name that you use in practice, because the idea of the register is that people, members of the general public, will be able to find their social worker's name on the register. So if you're practicing under your maiden name, then that should be the name on the register that we have. Then you get to employment details. This is a little bug at the moment, but just to be aware of. You might be asked, even if you've put the information in last year and the details haven't changed, you might get the red notes coming through. So that's the employment slide. I did just want to cover that. Then you are asked to declare if you're any potential health conditions, but only health conditions that might affect your practice as a social worker. So, for example, if you are if any health condition you have is mitigated, if it's managed by reasonable adjustments, you absolutely do not need to declare that to Social Work England. It's only if it's a particular health issue that might impact your practice. And it is worth looking on the specific guidance about that. So that's just something to be aware of around that section. You have to declare any convictions you might have had over the previous year as well, and then pay the registration fee or have the direct debit active. That's the next part. And then a number of declarations that you might have. So in terms of the declarations, I know you might not be able to read them, it's very small, but it's about agreeing to ensure that your CPD is completed. It's about the declaration that you are fit to work as a social worker, that you are agreeing to pay for the fees, that you note that you've read the standards. So those are the declarations, and then the confirmation. And that's what you should get after you've completed your renewal process. You will get the part that's orange on the form is a registration number to confirm that you've registered. The payment, this is because the direct debit is going to come out on the 1st of October. So if you've got your direct debit set up, it won't come out until the 1st of October. So that's why it's in progress. And then in terms of CPD, if you've completed it, you'll get the green. If you haven't completed it, because you can continue to go in and do the CPD afterwards, then it will come up there that you have to complete it or not. You can I can see some questions coming up about claiming back from your employer, and that's dependent on the employer. But you can claim back your registration fee. You can claim back the tax on your registration fees from the HMRC. So just to be aware of that. So that is an option. If you're self-employed, and I saw that question came up, there is actually you can write that into that box. So in terms of who your manager is, just you can write yourself as that manager. It's just to get past that, to explain, and there is a scope to do that in the box. And if you're unemployed as well, or at the moment, then again just write that into the box, and there is actually a part of the form which takes that into account if you're not currently employed in social work. And I think I mentioned right at the start, some of the people that were earlier, I was talking a bit about acronyms we use, and I find it sometimes useful to talk about continuing professional development in the full, because we can get a bit dismissive sometimes with the term CPD. So I find it useful to kind of draw me back, talking about continuing professional development, to draw me back to the purpose of it, which is about the constant learning that we do as social workers. And no matter what area of social work it is, what aspect of social work it is, we are all constantly learning on the job, and there are so many different ways in which we can learn, and that's all continuing professional development. So first of all, just to mention, and yes, I'll absolutely be talking about peer reflection a lot before the end, so don't worry about that, that's absolutely coming back. So for this year, there have been 3 changes in terms of compared to last year regarding continuing professional development. The first one is that 2 pieces of continuing professional development need to be logged rather than 1. The second one is that one of those pieces of peer reflection needs one of those pieces of continuing professional development needs to include a peer reflection, which we will be talking about imminently. And the third one is the form itself has changed. So previously we had the unstructured and structured form, but this year we do have one unified form. The idea is it's more to make it more straightforward. If any of you have had experience of using the form, it would be useful to hear in the chat what your experiences have been. I'm perhaps a little bit biased. I do think it's more it's more intuitive about what you need to do, and we will talk through the form. And reminder that the deadline for adding your CPD is the 30th of November, but really a request that you try and do that beforehand, not least because there's 2 pieces of continuing professional development this year rather than 1, and leaving everything to the last minute might leave you at risk of all sorts of things, including computer crashes, just going from previous years and experiences. So we talked a bit about what continuing professional development is, but in terms of what we're asking you at Social Work England is whatever piece of learning it is you do, and we don't define what that learning should be. That learning could be working on a particular case. It could be reading an article in a journal, but it could also be reading an article in a newspaper or a magazine. It could be watching a television program. Anything that makes you stop, think about your practice as a social worker and how you might use that learning to improve your practice can be continuing professional development. So it could be it could be a case that you're working on. It might often be. It might also be a conversation in supervision. And what we're asking you in Social Work England is whatever your piece of learning is, that you reflect on that learning. So it wouldn't be, I went on a training course. It would be, I went on a training course and reflecting on that training course. This is what I've learned from it and how it will impact my practice. And that's what we're asking you to do at Social Work England. So your learning, your reflection on that learning and how that learning will impact your practice, whatever practice that might be. So that might, whether you're working as a independent best interest assessor or working in an adoption and fostering team or working in the voluntary sector as a volunteer coordinator or working in policy, whatever your practice as a social worker is, that piece of learning will help your practice. And I mean, I've got a bit ahead of myself because this is what this slide is about, but some examples of what that continuing professional development is. But what we want to focus on, as I say, at Social Work England is really not the what so much as the what do you get from that learning. So I can see there's a question about writing an article. Absolutely, you can write on your reflection about what you learned from writing that article. So that's what we're trying to get to, is that, I mean, I've had examples of continuing professional development from people watching soap operas and reflecting on a storyline and how that might impact their social work practice. Reading a poem, but one that makes you think and stop and think from a different perspective and how that might change our practice. Or something like level 3 safeguarding adults training, and how that's changed your practice. So it's not just what you learn, but it's what that learning has meant for you as a social worker. And this is the standard that we use. So standard 4 is the CPD standard. And you can see that there are 8 parts to that CPD standard. What we say is that, it would be great if you could cover all 8 of those in a year, but you don't need to. So just to be aware that you don't need to cover all of these in a year. I know it's quite small, the writing on the slide. Do have a look under standard 4. Obviously, you'll see them. But these different aspects of continuing professional development are what we're trying to pull out in the standard. So, for example, over the last couple of years, standard 4.4, where we talk about developing knowledge of current issues in society, and it may be about reflections on working through COVID, reflections on the murder of George Floyd, all sorts, those kinds of things that we're working with that change on a day-to-day basis might come in 4.5. And talking about, I know somebody mentioned writing an article, and 4.5 might well be about creating an open and a learning culture, and that might be an area that you focus on. But do want to mention that the two that you have to cover each time you add a piece of continuing professional development are 4.6 and 4.7. So do focus on those and think those through, because those you will have to focus on. Now 4.7, in a way, if you read it just by completing the form, you're going to be doing 4.7, record my learning. So just by entering your CPD, you've got to do 4.7. So 4.6 really is the key to it. You need to have that reflective part of the entry. That's really the key. So it's not just descriptive. You have a space to reflect on your learning. And all these different examples, I can just see the personal experience, absolutely personal lived experience is one of the areas that you can reflect on and learn from. Anything that you can reflect on, learn from, and that can impact your practice. Another example that I've often been given, particularly maybe people that are on maternity leave, for example, reflecting on the changing status, the changing family situation, having a child, what that means. Can't think of some more significant lived experience that one can reflect on and learn from. But there's all sorts of different levels. These are just some examples, and we all have personal experiences that we can't give examples of, but it's really the focus is on the reflection and the learning. Now I'm going to talk about peer reflection. So first of all, who is a peer? We'll start with that. So a peer can be another social worker, but it doesn't have to be a social worker. So it's another professional that has some link with your work or some awareness of your work. So I'll give some examples. So before I joined Social Work England, I mentioned that my work background is in mental health. I worked in a multidisciplinary team in a hospital. My peer reflection could just as well be with one of the nurses that I worked with, or the occupational therapist that I worked with, or the psychologist or the doctor that I worked with. So it didn't need to be another social worker, although it could be. The peer doesn't need to be an absolute peer on the same level as you in terms of hierarchies. So you can have your peer reflection could be with somebody, it could be with your manager, or if you're a manager of a team, it could be one of the social workers in the team. We ask that it's not a student at the moment. So that's in terms of who that peer can be. It can be formal or informal. So it could be a chat with a colleague over a cup of tea, or it could be a formal peer reflection group, because that's the other thing, is it could be a group as well as one-to-one. So if you, for example, have a slot in a team meeting to talk about a piece of learning that you've done and people input, that can be your peer reflection. So those are some of the context. The other thing just to mention, and I think it is on the slide, is your peer can be your manager. So whatever professional background your manager is, your manager can be counted as the peer. So that's so just to mention that. So and there's guidance in the slides. So that's just a bit about who. I'm going to talk a little bit about how now. So I'll give an example of, this is a situation I used. Obviously, it was last year, so we weren't using peer reflection, and it was before I joined Social Work England. But I was working on a case. I was working on mental capacity assessment, particular area. I've done lots of mental capacity assessments, but this was particularly unusual circumstance, and it was through COVID. So we were having some of the conversations via Teams that we would have usually had face to face with family members, with other professionals. So my learning was by working in different ways, by reading up, by some of the case law that I was reading up about doing this particular piece of work, and by discussing it with my manager and getting advice about that from colleagues. So that was my learning. Then I I met a colleague who was in the office. This was as we were coming back from COVID, so we hadn't seen each other too often. And, we were saying hello. And I then started talking to her about this piece of work that I'd done and kind of where I'd gone with it and how I'd managed it. And she gave me some suggestions and she talked about similar work she'd done. Now, that was the peer reflection. So I was talking to somebody who was a peer, it was another social worker in my team, about some learning that I'd done. Now, in terms of the peer reflection, you don't need to mention on the form, in fact, you shouldn't mention on the form the name of the person. We want all input is anonymous. So I would write, I had a discussion with my colleague who is a social worker. And this is what I gathered. She gave me some suggestions. She gave me some ideas about what to think about. I thought about this from a different perspective. So I'm not naming her. I'm not, I'm also, yeah, so I'm not, she doesn't need to verify it. Nobody needs to kind of, just because I've had these questions before, nobody needs to confirm they've done the peer reflection with you. It's about your thoughts and your reflections. So it's what you learn from having a conversation with your peer about the learning that you've done. So that's the peer reflection. You do get, one of the changes for the forms this year is that there are rough word guide counts. So roughly for the peer reflection, we talk about a minimum of 250 words. It's not hard limit, but that's roughly what we're expecting. So just to say, it's a couple of paragraphs, 2 or 3 paragraphs. So that's what we're looking for as the peer reflection. And your peer reflection, it can be a write-up of a conversation during supervision, but it can also be, as I say, it doesn't have to be that formal session. It can be those informal chats that happen. It can be a specific peer reflection group. Again, when I was in the hospital, we used to have, peer reflection groups, and that is exactly what those kinds of things are designed for. I'm just going to touch on the form itself. We can still keep answering questions. I mean, shall I stop a moment actually and just see if there are any questions specifically about peer reflection before I move on?
Vicky, that I'm going to just try and answer a couple of the questions, or we can all try and do it,
Yeah.
that have come through. So I think one of the questions has been about people who are self-employed as social workers who don't have a manager. I think there was someone making reference to being absent from work. I think it was due to maternity leave. On that particular point, you can still renew. You can still complete continuous professional development. In fact, one of the options on continuous professional development is to record something which is about lived experience. And so an example, for example, of somebody who's been off on maternity leave, I know that I previously worked in maternity social work, and so that kind of experience could actually feed into your professional development. And for those people who don't have who are, say, the only social workers in their organization, a peer doesn't have to be a social worker. It can be a colleague. We've got a list of people who could count as a peer when you actually go to complete the form. So do take a look at that. And for those people who perhaps are worried that they can't get a peer reflection in before the end of November, because they can't find a peer and they haven't had a chance to record anything, we're actually running some sessions based on the standards, and there's, I think the next one is next week, which will be looking at standard 3. So you can sign up to one of those sessions, and that could potentially count as a peer reflection, because we all come together as a group and then we break off into smaller groups within that session, and so far they've been quite successful. Just a couple of other things. There's I think someone's asked, do I need to record which standard, and will that go towards the word count? You don't need to do it in the body of the text. so that wouldn't necessarily eat into the word count or the word limit. And there's actually you can actually tick which standard you feel that you've met. So it won't, so it doesn't affect it in that way. You don't need to worry about it eating into the word limit.
But just to talk again through this is the CPD form that you're doing. The changes are that there's a drop down list about types of CPD. Hopefully I kind of reassured you that there is a massive scope of that. So alongside about 12 different options, there is an other option as well. So it's for you to tell us what's helping you learn. First question is what did you do? A simple description. What did you do, and how does it link to your role as a social worker? And it's asking for you that from you in 15 to 30 words. We do have word counts on this year. That's one of the changes. So it literally is a sentence. I did this because I do this. I attended level 3 adult safeguarding training because I'm currently employed in a hospital, and it's important for me to keep my understanding of safeguarding up to date. My learning was from this mental capacity assessment that I did in the hospital because I'm forensic social worker working in a hospital, and this was incorporating areas that were new to me in my current practice. So really short, 15 to 30 words. What did you do? Next question is, what did you learn? And that's again descriptive. 250 to 500 words is what we're asking as a ballpark. That's not a hard limit, but it's just to give you an idea of how much to write. What did I learn from this piece of CPD that I did? The third question is the 4.6 question, that reflecting on that learning. How would this impact or how has it impacted my practice, or how would it impact my further practice? So that's the reflection question. That's the third question. Again, 250 to 500 words for that question. The next question on the form is the peer reflection, which you only need to include for one of the two, although you can add it for both if you want. And that one is, I'm doing this a little bit off the top of my head, but it's more or less after discussing this with a peer. These are my reflections having discussed this with a peer. And again, that's saying that's saying I think a minimum of 250 words. That's slightly different. And then in the form, you tick whichever of the standards you feel you've met, and then go on and confirm. And just to mention, the form does time out after 60 minutes. So one thing I do, because I've certainly been caught out by that, certainly when I was in my previous job, when I'd start and then the telephone call would go, and then I might go off and get a cup of tea and come back and find out that my CPD had timed out, is I actually write it on a Word document and copy and paste it in. But if you're good at remembering to press save or doing your CPD in 30 minutes, which is entirely manageable, you don't need to do that, but just to be aware of that. So that's what the form looks like. Do have a look through it and give it a go. Just mentioning there are employer standards as well that you might want to reference wherever you work, particularly around encouraging social workers to think about their CPD and supporting social workers to meet their peer reflection standards. And we've linked to the Local Government Association Standard 6 in the slides when you get them. I know people have talked about what happens afterwards, and this is really where I'm going to capture that. So after the renewals period closes on the 30th of November, Social Work England select a random sample of 2.5% of social workers to have their CPD reviewed. This process, you would be informed of this at the beginning of January if you have been selected for review. If you've been selected for review, you don't need to do anything. It's not like the HCP process was. So you've already submitted your CPD. There is a team within Social Work England who will review those pieces that were selected for review. And they will be doing that between the January and the March. I know last year they were guaranteeing to get back by the 31st of March to hear back about the review. And there'll be two possible outcomes to the CPD review. One of which is accepted, which is exactly what it says. It's fine. Your CPD is fine. But the other option is advice given, which is literally advice is given to you. So you will be given that advice about how you could improve the CPD or why it might not have met the requirement. So that's the CPD. And just as a guidance, and I've got the figures, they're for 2021. Around 89 people were given advice from that group of around 2,500 social workers whose CPD was checked, just a bit of a ballpark. There are two exceptions to the random sampling. One is if you are given advice 1 year, you will be selected for the CPD review the next year. So, and if you're a newly qualified social worker in your first year of practice, you're not selected for review. So those are the two exceptions. So that's how it works in terms of the CPD review. If you've been given advice, will it affect your registration? No, is the current answer on that. You will be selected the next year, though. In terms of Maureen's question, sorry, I'm just going through this as I'm here, has been on long-term sick for 7 months back now. She might not have examples for CPD this year. How does this work? What I'd say is, think about CPD creatively. CPD isn't necessarily attending courses. It can be life experience. It can be reading an article from a book. It can be, how has she kept up to date with her social work? That's what we want to see. If you've been long-term sick and then you come back, maybe there's something in that process of coming back that reflects your continuing professional development. So that would be the answer there. So I hope I'm not just running through. I'm not missing ones. Why would you be selected if you were given advice? It's to check, because if you've been given advice 1 year, it meant that you didn't meet that requirement. So being asked again is to just to see if you've managed to improve in terms of the requirements there. And sorry, I'm just kind of trying to run through. Am I missing things?
Yeah, so I'll just come to one. So there's one here, Vicky. Someone's clarifying: do you need to complete 2 pieces of continuous professional development, separate topics, and then a peer reflection on one of those? So I think that the main thing to remember, Rebecca, is that you've got to do a minimum of 2 pieces of continuous professional development. So that's 2 different online forms. It's the same form twice, and at least one of those needs to be a peer reflection. They could both be peer reflections, but it only has to be one. And you can do more than the 2 as well, but minimum, absolute minimum, 2 pieces, and one of them has to be a peer reflection. And you'll see in the form, in each form, there is one box that is you complete when it's a peer reflection, and that's how the system records it as a peer reflection. So go through, have a look at the forms, and then it should be a self-explanatory. But if you need any kind of if it's still not clear, then do email us. I've put my email address in the chat.
Oh, that's great. Thank you very much.
I'll just go through to the next one. Sorry. Social workers qualifying. Yes, you do need to. So Beverly, social workers qualifying this year do need to undertake the CPD, but may not be selected for review. But you do need to complete the CPD regardless within that time. The PowerPoint will be sent out. Sorry, I'm just taking a bit of time to read as I'm going. And yes, Anna, the CPD recording could be about, I think, the impact of returning to work from long-term sick in terms of a personal lived experience would be a very rich learning experience to relate about learning through that.
Vicky,
Sorry.
We've got one question here about what if I'm not working as a social worker but as a mental health practitioner. The key thing, as Anna, is if you're a social worker, and that's the position to come from, rather than what your job title is. So you reflect on how you meet the standards rather than what the job title is. And someone's asking if the peer reflection has to be someone with a qualification, or can it be, for example, an assistant occupational therapist or healthcare assistant? So it's on the list, who could be counting as a peer. But I would say it's somebody you'll be potentially working with, another professional. So I don't see why those examples couldn't potentially be peers.
I'm going to move on with the slides for a minute, but just quickly, Hannah, the peer doesn't need to do anything apart from listen to you and respond to you. You're writing up your reflections about the conversation. So just some things to remember. I've talked about it a lot. The deadline, please try to get this done. Try to block out some time now to get this done, so you're not leaving it until the last minute. Just to note that the requirements have changed. So we've talked about this, but it's 2 pieces and 1 piece with a peer reflection. Make sure you save your work as you're going, so you don't do stupid things like me and time out from the form. And again, don't leave it to the last minute. You can see we were quite insistent on that one. What I've put on the slides, these are some other like learning opportunities that we've presented through Social Work England. So we've got lots of videos on our YouTube channel from our Social Work Week, both this year and last year. I mentioned the Social Work in England report. If you're interested in looking at that, that's got some of the information about, feedback about where social work is in England. We've got the podcasts that we've published. These are what we're doing the peer reflections on. So, but they're useful in their own right, even without the peer reflections. So I'd recommend listening to those. I've put a link to where our consultations come up. If there's future consultations from Social Work England, you might to keep an eye out for. And then obviously there's the newsletter that we publish. So I hope that's helpful. We can take questions. We've got a few minutes left. I know, do get in contact with us. If I don't know if we can put in the link to the Region Engagement Lead page where there's all of our respective email addresses and contacts if you have particular questions. And yeah, thank you very much for coming and spending your time. I think there might be some more questions to answer that, but the presentation will be sent out to people.
Vicky, there's one
Other
question here that I think is quite helpful to respond to for everybody. The question is can experience from voluntary work like Samaritans count as one social work skills competencies drawn? But I think this reference is can that voluntary work go towards continuous professional development records? And I would say yes. Key thing is to remember is it's professional development. So if that work that you do, whether it's the paid work or unpaid work, is helping enhance your social work skills and abilities, then that is something that is going towards your professional development.
Yeah, I mean, it's important to remember that social work happens in so many different ways. So it's anything that impacts your practice as a social worker, whatever that practice as a social worker looks like, then it absolutely can be learning.